Good afternoon, everyone. Myself, Tahira Aziz, junior resident in the Department of Ophthalmology, AMU Aligarh. Today, I am going to present my study titled Conjunctival Impression Cytology in Patients with Dry Eye Disease and Low Vitamin D Levels, a hospital-based observational study. Vitamin D has been demonstrated to have anti-inflammatory and immunoregulatory effects in several studies. It has been found that vitamin D receptors in the corneal epithelium, as well as the role of vitamin D in maintaining corneal epithelial barrier function, and some transporters like megalin, cubilin in tear-producing glands, which suggest that it has a significant role in ocular surface homeostasis. The conjunctival impression cytology is the process of removing 1 to 3 surface epithelial cell layers while maintaining the original morphology. It is comparatively simple to perform, minimally invasive, and causes the patient least amount of discomfort by providing accurate information about the area sampled. Our purpose of the study is to evaluate the CIC findings in patients with dry eye disease having low vitamin D levels, with an aim to study the potential role of vitamin D in maintaining conjunctival epithelial integrity. It is an observational cross-sectional study conducted at our institute for 1 year. Consecutive sampling of eligible patients were done, and sampling units were taken as clinically diagnosed dry eye disease patients. Sample size was 40, and assessment was done based on dry eye disease diagnosis, Schirmer's 1 and 2, Tibet, Osdi-Questionnaire. Vitamin D status with less than 20 nanogram per ml was taken, and cytology, CIC, was formed from temporal bulbar conjunctiva stained with PAS and H&E and graded by Nelson's classification. The inclusion criteria was patient aged more than 18 years, clinically diagnosed with dry eye disease, serum levels of vitamin D less than 20 nanogram per ml, and who gave informed consent. Our exclusion criteria was any prior ocular surface disorder other than DED, history of ocular trauma or surgery, use of medications affecting tear film, diagnosed systemic diseases like diabetes, mellitus, hypertension, and patient unwilling to participate. These are the baseline socio-demographic characteristics of the study participants, with maximum patients belonging to age group 18 to 30. Mean age was 35.1 plus minus 13.9 years. Mostly were males residing in the urban population, and patient belonged to college and above group, and the occupation mostly were unemployed, which included students as well. The results included the mean vitamin D levels in males to be 12.4, in females as 11.2, and overall it was found to be 11.8 nanogram per ml. These are the figures showing distribution of study participants according to CIC grade. Most of the patients had grade 2, and lesser patients had grade 1, and in our study, which was of 40 participants, none had 0 and 3 grades. The correlation of vitamin D levels with CIC grade was done, and based on it, it was found as negative correlation was found as minus 0.445, and it was found to be significant, the p-value. These are the photographs of the CIC slides that we made. The first figure shows the Nelson's grade 1 showing sheets of epithelial cells with NC ratio of 1:3. This is an H&E at 40x magnification. The next slide, we can see sample from the same patient on PAS stain with arrows showing the goblet cells. In the next figure, we can see Nelson's grade 1 showing good cellularity of epithelial cells in sheets, H&E at 4x magnification. And the other slides, the next one shows the grade 1 showing epithelial cells having ratio of NS to C ratio 1:2, and the arrows showing the goblet cells, H&E at 40x magnification. This is the grade 2 showing goblet cells on PAS stain at 40x magnification. And the next figure shows epithelial cells with squamous appearance and NS to C ratio of 1:3, and it is PAS stain at 40x magnification. So our study concluded that vitamin D deficiency is associated with abnormal conjunctival impression cytology in patients with dry eye disease. A considerable proportion of patients exhibited squamous metaplasia, goblet cell loss, and higher Nelson's grade, predominantly grade 2 in our study, indicating impaired epithelial homeostasis. The changes seen correlated inversely with serum vitamin D levels, suggesting that lower system vitamin D is linked to more severe ocular surface pathology. Our results suggest that vitamin D deficiency may not only be a systemic risk factor, but also a potential modifiable contributor to ocular surface disease. Correction of hypovitaminosis D could therefore play a supportive role in improving epithelial health. reducing squamous metaplasia and enhancing goblet cell density in dry eye disease patients. Thank you.
So would you like to suggest vitamin D to?
Yes, according to our findings in these 40 patients, we saw that the vitamin D levels, the low serum vitamin D levels, they were associated with metaplastic changes in the cells like increased NC ratio, and so it is an ongoing study. We are enrolling more patients.
What is duration of study?
Yes, sir.
Time duration of study.
It is 1 year. It has been just 1 year, and we have 40 participants enrolled.
Have you seen any changes in symptomatology after giving vitamin D or
Yes.
this part?
Yes, sir. I have seen. I have after 8 weeks of intervention. Although the grade of Nelson's grade not much improvement, but the cytological changes have been seen, and they have been noted also.